In this video, we're talking about the rotator cuff. Now you've probably heard of it, but what is it? What does it do? And how do I know if I've injured it? Well, that's exactly what we're gonna be talking about today, so stay tuned and let's get into it. The shoulder is a ball and socket joint, meaning that the humerus, the upper arm bone over here, attaches into the shallow groove of the scapula, in other words, the shoulder blade. Your arm is kept in its socket by a group of 4 different muscles called the rotator cuff. The rotator cuff attaches the humerus to the shoulder blade, and it also has some other functions in terms of lifting the arm and rotating it as well. When any of these 4 muscles are injured, you can start having some serious pain. There are 2 general classifications of injury with the rotator cuff. Now, the first classification of injuries would be an acute tear. Now, this typically happens if you're lifting something really heavy with a jerky movement. It can also happen if you fall on an outstretched arm, kind of like that. Rotator cuff tears can also happen from other shoulder injuries as well, like a broken collarbone or a dislocated shoulder. The second category of injuries are degenerative tears. So this is a normal part of aging where the tendon starts to wear down a little bit, and this can result in quite a bit of pain in some people. Now we've talked about what a rotator cuff injury is, let's hop into what you might be feeling if you have a rotator cuff injury. So these are some signs and symptoms to watch out for. Pain going from the shoulder, usually down to about the elbow. You might be having pain lifting or lowering your arm. You might notice some weakness with a lot of your shoulder movements, and you might even get a little bit of a cracking sensation while you move your shoulder. Now, how do we get it better? Most rotator cuff injuries are managed with what we call conservative care, meaning we use a combination of rest, medication, and strengthening to help you feel better. Now, if we don't see too much improvement with conservative care, usually around the 6 to 12 month mark, your doctor might even consider surgery as an option, but that's for severe cases. As a physiotherapist, rotator cuff injuries are one of the most common conditions I tend to see at the clinic. But don't worry, rotator cuff injuries aren't the end of the world. Many people live with rotator cuff injuries without any symptoms, and the body has a remarkable capability to be able to heal itself from injuries. If you think you or someone you might know might have a rotator cuff issue, a good place to start is by seeing your physiotherapist or your doctor to get started on the road to rehabilitation and get that shoulder feeling better, because it can definitely get in the way of everyday life. That's it for today, guys. Hopefully you learned something about rotator cuff injuries. Remember, the best place to start is talking to your doctor or your physiotherapist and getting a thorough assessment to figure out exactly what's going on with your body, because everybody's body is a little bit different. Until next time, my name is 𝗪𝗂𝗳𝘳, and we'll see you again in the next video.